Most people think death arrives like a thief in the night. Sudden, shocking, impossible to predict. One moment you're here, the next moment, gone. But the truth is far different. In reality, the body almost always leaves warnings before it shuts down completely. And those warnings are often quiet, subtle, and easy to dismiss as just old age. Doctors who study aging and end-of-life care say the body doesn't go silent. It speaks. It signals. It sends out tiny red flags that, if we only paid attention, could tell us that the end may be closer than we imagine. These aren't dramatic Hollywood moments. They're everyday changes that sneak up slowly. Strange shortness of breath, even while resting. Swelling in your feet and hands. Night sweats that soak your sheets. Sudden chest pains you chalk up to just getting older. Or a rapid decline in your strength and clarity over just a few months. The scary truth? Most people ignore these warnings. They tell themselves, "I'm fine. It's just age. It's nothing serious." Families overlook them too, thinking, "That's just how grandma is now." And so the signs go unnoticed until the day comes when there is no more time left. Think of your body like a finely tuned machine. Before a car breaks down completely, it gives you clues. A flashing engine light, a strange noise, a leak under the hood. Ignore those, and sooner or later, the car won't start. The human body works the same way. Only difference is, you can't buy a new one. You have just this body, this lifetime, and these signals are your only warning. This video is not here to frighten you without reason. It's here to open your eyes, because if you're in your 60s, 70s, or beyond, these subtle symptoms can mean the difference between catching something early and having precious years stolen away. So listen closely. In the next few minutes, we'll uncover 5 critical signs that doctors say could mean you're closer to death than you think. They're not meant to scare you, but to help you notice what truly matters before it's too late. Stay with me until the end, because what you learn today may just save your life or the life of someone you love. Let's get started. First sign. As we grow older, it's normal to feel slightly winded after climbing stairs or carrying groceries. But there's a big difference between the expected fatigue of aging and a breathlessness that appears without reason. If you're struggling to catch your breath while sitting, speaking, or walking across the room, your body is sending a warning, a serious one, that many people unfortunately ignore. Doctors call this symptom dyspnea, difficulty breathing. While it might sound simple, persistent shortness of breath can be one of the clearest early indicators that the heart, lungs, or overall body is under stress. It is often linked to heart failure, chronic lung conditions, or in some cases, signals that the body is entering the final stages of life. The lungs are supposed to move oxygen effortlessly into the blood, but when fluid starts to build up, or when the heart can't pump efficiently, even small movements can leave you gasping for air. Take John, a 74-year-old retired teacher, for example. At first, he noticed he got winded while putting on his shoes or climbing a short flight of stairs. He laughed it off, telling himself, "I'm just out of shape." But within a few months, something changed. He found himself waking up at night struggling to breathe, needing multiple pillows just to sleep upright. Walking to the mailbox felt exhausting, and even short conversations left him catching his breath. When he finally saw his doctor, he learned that his heart was failing, and the shortness of breath had been his body's warning all along. What had seemed like minor fatigue was actually a serious signal his body could no longer ignore. The scary reality is that many seniors dismiss this symptom, attributing it to anxiety, stress, or simply getting older. Families may even unknowingly reinforce this denial, saying, "That's just how grandma is now." But constant breathlessness is rarely benign. It's a red flag, a flashing signal that something critical is happening inside. Doctors report that this is one of the most common early signs they observe in patients who are approaching the final stages of life. Persistent shortness of breath doesn't just affect the body, it changes the way life feels. Tasks that used to be simple become exhausting. Walking across the kitchen, climbing a few steps, or bending to tie a shoe can suddenly feel overwhelming. And the mental toll is significant. Anxiety, frustration, and even depression can develop as the body struggles to get enough oxygen. Ignoring these feelings is easy, but doing so can be dangerous. It's important to remember, not every episode of breathlessness signals impending death. Sometimes it's treatable or linked to conditions that can be managed with medication, therapy, or lifestyle changes. But the key is recognition. If the shortness of breath is persistent, unexplained, and affects daily activities, it's a warning that demands attention. Early intervention can sometimes stabilize the condition, improve quality of life, and in some cases, extend the remaining years. Your body doesn't send this signal lightly. It's not a nuisance or a minor inconvenience, it's an alarm system. And like any alarm, ignoring it only increases the risk. If you or a loved one is noticing this symptom daily, it's crucial to seek medical evaluation immediately. Because constant shortness of breath isn't just about discomfort, it's about survival. About the precious time that your body is quietly telling you may be limited. Second sign. At first glance, swelling in your feet, ankles, or hands might seem harmless. You might blame it on a long day of standing, salty food, or even warm weather. But if the swelling persists, day after day, week after week, it could be a silent warning from your body, one that doctors take very seriously. Chronic swelling, medically known as edema, is more than just discomfort. It can indicate serious underlying conditions, including heart failure, kidney issues, or circulatory problems, all of which can shorten lifespan if ignored. Take Linda, a 78-year-old grandmother who had always been active. She loved walking her dog every morning and tending to her garden. One winter, she noticed her ankles seemed puffier than usual. She thought it was the cold, or maybe she had stood too long while baking for her grandchildren. But the swelling didn't go away. Soon, her feet hurt after just a short walk, and she began skipping walks she had once enjoyed. Her energy dropped, and she felt heavier, slower, and increasingly fatigued. When she finally saw her doctor, tests revealed her heart wasn't pumping efficiently. The swelling, a seemingly minor symptom, had been her body's urgent signal that something serious was wrong. Persistent swelling isn't just about appearance or discomfort. It reflects fluid accumulation in tissues, often caused by the heart or kidneys struggling to function. When the heart weakens, it can't pump blood effectively, causing fluid to pool in the lower extremities. Kidneys, when compromised, fail to remove excess water, leading to puffiness in hands, feet, or even around the eyes. The danger is that this fluid retention can precede other severe symptoms: shortness of breath, fatigue, and even sudden hospitalization. Many seniors dismiss swelling as a minor annoyance, especially if it's painless. Families may reassure each other, saying, "It's just age," or "Everyone's feet swell sometimes." But ignoring it can be deadly. Doctors consistently warn that unexplained, persistent swelling is one of the body's subtle ways of signaling that internal systems are failing. It's like a warning light on a car dashboard. You wouldn't ignore a flashing engine light. And neither should you ignore swelling that comes without clear cause. It's not only about noticing swelling, it's about acting on it. If you see persistent puffiness, especially when accompanied by fatigue, shortness of breath, or rapid weight gain, you need to consult a doctor immediately. Early detection can mean better management of heart or kidney problems, potentially adding years to life and improving daily well-being. Swelling in your feet, ankles, or hands may seem minor, but it's a reminder that the body communicates constantly, often in ways we underestimate. These subtle, invisible signals often precede more severe conditions. Paying attention could make a difference between early intervention and being caught off guard by sudden decline. Remember, the body doesn't warn without reason. Persistent swelling is a whisper, a cry, a flashing signal that your health may be at serious risk. The moment you notice it, take it seriously, because sometimes what appears small on the surface can hide life-altering consequences underneath. Third sign. Most people dismiss chest or back pain as a result of aging, stress, or muscle strain. You may think, I slept wrong, or I overdid it in the garden. But sudden, unexplained pain in your chest or upper back, especially if it appears without physical activity, can be one of the most critical warning signs your body sends, and one that doctors take very seriously. This pain could indicate heart problems, blocked arteries, or even the early stages of serious systemic issues that often precede the body's final phase. Take Robert, a 76-year-old retired engineer. One morning, while simply reading the newspaper, he felt a sharp, unfamiliar pain between his shoulder blades. He ignored it at first, attributing it to tension from sitting at his desk too long. Over the next few days, the pain came and went unpredictably. He thought it was nothing serious. But one evening, the discomfort returned suddenly, accompanied by shortness of breath and fatigue. At the hospital, tests revealed he had significant coronary artery disease, and the pain had been his body's urgent alarm. What seemed like a minor ache was actually a critical symptom that could have led to a life-threatening event. Sudden chest or back pain is often overlooked because it doesn't always follow the classic heart attack pattern we see in media. It can be vague, dull, or intermittent, making it easy to rationalize or ignore. But physicians warn that this type of pain is a major red flag, particularly for seniors over 70. It signals that the heart or nearby organs may not be functioning correctly, and in some cases, it can be one of the last early indicators of declining health. The danger of ignoring these signals is significant. Pain in the chest or back may precede more severe complications, including heart attacks, organ failure, or sudden health crises. Many people mistakenly assume these aches are harmless signs of aging, but the body is never random in sending such alerts. Persistent or sudden unexplained pain is the body's way of saying something is critically wrong. It's important to recognize that not every twinge of discomfort means an immediate life threat. Still, sudden, recurring, or unexplained chest or upper back pain, especially when combined with other symptoms like fatigue, breathlessness, or swelling, must be evaluated promptly. Early medical intervention can identify underlying conditions, prevent emergencies, and significantly improve quality of life. Ignoring this pain is like ignoring a warning light on a car that could signal a brake failure or engine problem. You wouldn't do that with your car, so why risk it with your body? Your chest and back pain may be subtle, but it's your body's loud alarm, demanding attention before it's too late. This is why doctors emphasize listening carefully to your body. Sudden, unexplained pain is rarely just aging. It's often a glimpse into your internal health, and it could signal that your body is approaching a critical stage. Recognizing it, seeking help, and taking timely action can save precious years and possibly your life. Fourth sign. Many people think night sweats are just a nuisance, a warm bedroom, too many blankets, or maybe a hot cup of tea before bed. And fevers? Most assume they're just part of the occasional cold or flu. But when night sweats become severe, drenching your sheets regularly, or fevers appear repeatedly without a clear cause, your body may be sending a serious warning. Doctors warn that these symptoms, when persistent, can signal hidden infections, autoimmune disorders, or even certain types of cancer conditions that often show themselves quietly before the final stages of life. Take Martha, an 81-year-old retired nurse. She had always been healthy, walking every morning and spending time with her grandchildren. Over several months, she began waking up, soaked in sweat, almost every night. At first, she thought it was her old heating system or menopause, lingering in later years. Soon, she noticed she also had low-grade fevers she couldn't explain. She ignored the symptoms, assuming they would pass. By the time she consulted her doctor, tests revealed an undiagnosed infection that had weakened her immune system significantly. What seemed like just sweat was actually a warning sign her body had been sending for months. Night sweats and unexplained fevers are more than uncomfortable. They are the body's alarm system. Persistent sweating and recurrent fevers signal that something inside your body is out of balance. The immune system may be struggling to fight hidden infections, or internal organs may be under stress. These symptoms are often overlooked because they appear gradually and can be mistaken for stress, menopause, or minor illness. But physicians stress that in seniors, especially those over 70, repeated night sweats and fevers are often an early indicator of a body in decline. It's not just about the discomfort. Severe night sweats can lead to dehydration, disrupt sleep, and weaken overall health, accelerating other age-related conditions. Frequent fevers may mask underlying infections or diseases that require prompt treatment. Ignoring these signs allows potentially serious health problems to progress unnoticed. Many seniors rationalize these symptoms, telling themselves it's part of aging or just minor illness. Families often think the same, assuming a few nights of sweating are harmless. But the truth is, the body rarely acts without reason. Persistent night sweats and fevers are signals that shouldn't be dismissed. They are subtle indicators that your internal systems are struggling, sometimes seriously. Doctors emphasize vigilance. If you notice severe, unexplained night sweats or repeated fevers, it's crucial to seek medical advice immediately. Early detection can uncover hidden infections, autoimmune conditions, or other serious illnesses. Acting on these symptoms can improve quality of life and, in some cases, extend it significantly. Your body communicates constantly, often through subtle signs we overlook. Night sweats and recurrent fevers are not random. They are urgent messages. By paying attention and responding, you give yourself a chance to address underlying health issues before they escalate. Ignoring them could mean missing the last opportunity to intervene, making what seems minor now potentially life-altering later. Fifth sign. As we age, gradual changes in strength and memory are expected. But when mental clarity and physical abilities decline rapidly over a few months, it's more than just aging. It's a serious warning. Doctors often observe that a sudden drop in both mental and physical function can indicate major underlying health issues, from organ failure to neurological decline, and sometimes signals the body is entering its final stages. Take Henry, an 82-year-old retired accountant, as an example. Just 6 months ago, he was walking his dog every morning, balancing his checkbook, and even volunteering at the local library. But over a short period, things changed dramatically. He began forgetting familiar words, misplacing items constantly, and even struggled with tasks he had done effortlessly for decades. Simultaneously, his physical strength deteriorated. Walking became exhausting, climbing stairs felt impossible, and even dressing himself became a challenge. What seemed like ordinary aging was actually a rapid decline. Doctors recognize as a critical warning sign. Rapid mental and physical deterioration can be caused by multiple underlying conditions: heart failure, kidney or liver disease, severe infections, or even certain cancers. Neurological conditions, including dementia or stroke-related complications, can also accelerate this decline. The frightening part is that these changes often appear gradually enough to be normalized by the person or their family, yet quickly enough that if unaddressed, they can severely shorten life expectancy. Families often notice subtle cues. First, the once social grandparent who withdraws from conversation, the meticulous hobbyist who loses interest, or the independent senior who suddenly needs help with daily activities. Ignoring these signs or attributing them to just aging can be dangerous. Doctors stress that when mental and physical decline occurs rapidly, it is a clear call for immediate medical evaluation. This decline isn't just inconvenient, it affects quality of life, independence, and safety. Sudden weakness increases the risk of falls, injuries, and hospitalizations. Cognitive decline can lead to confusion, poor decision-making, and vulnerability to illness. Left unchecked, this rapid deterioration often precedes more serious complications that may appear in the final months of life. Recognizing these signs early allows for timely intervention. Even if full recovery isn't possible, proper medical care, physical therapy, cognitive support, and lifestyle adjustments can improve comfort, slow decline, and give families more meaningful time together. The body rarely sends such clear warnings without reason. Rapid decline is one of the strongest indicators doctors use to identify seniors at high risk. Pay attention to sudden changes, both mental and physical. Listen to your body and observe your loved ones closely. Rapid deterioration is not just getting old. It's a flashing alarm, a signal that the body is struggling in ways that could determine the remaining span of life. Ignoring it can cost precious time, but acting on it can make all the difference. Life is fragile, and our bodies often give subtle warnings before something serious happens. The 5 signs we've explored: shortness of breath, swelling, fatigue, night sweats and fevers, and rapid mental and physical decline are not meant to scare you, but to help you notice what your body is trying to tell you. Ignoring them could mean missing the chance to act, get treatment, or spend more meaningful time with your loved ones. Remember, age is not destiny. Many seniors live long, healthy, and fulfilling lives by paying attention, seeking timely medical advice, and making small but important lifestyle changes. These signs are not sentences, they are opportunities to protect your health and improve your quality of life. If you noticed any of these signs in yourself or someone you care about, don't wait. Talk to a doctor, take action, and cherish the moments you have. Your body is speaking. Listen carefully. If you found this video helpful, make sure to subscribe, like, and leave a comment sharing your thoughts or experiences. It really helps us create more content that matters to you. Thank you for watching, and we'll see you in the next video.